A headline like this sounds almost too good to be true, doesn't it? Knee pain down by a huge number with one simple move in just a few minutes a day. But here's the part most people over 70 are never told. The problem is often not just age, not just bone on bone, and not just bad luck. Very often, the muscle that is supposed to protect your knee has gone quiet. And when that muscle goes quiet, every step, every stair, every time you stand up from a chair can feel like your knee is paying the price. More than 650 million adults over 40 worldwide live with knee osteoarthritis, the most common wear and repair form of arthritis in the knee. That is a massive number. And if you are over 70, you may have already noticed the pattern. You sit for a while, then the first few steps hurt. You avoid stairs. You grab the table before standing. You tell yourself, maybe this is just what happens now. But what if one of the biggest mistakes is the thing most people do automatically, resting the knee more and moving the right muscle less? This is exactly why major medical groups keep repeating the same message. The American College of Rheumatology and the Arthritis Foundation strongly recommend exercise for knee osteoarthritis. Mayo Clinic says strengthening exercises help support and protect the joints. And the CDC reminds older adults that even 5 or 10 minutes at a time can count. Not an hour, not a gym session, sometimes just a few careful minutes. And that is why this channel exists, to turn confusing health advice into clear, useful steps that can actually help you feel safer in your own body. So if you believe simple, honest health education should reach more older adults who need it, subscribe now. It truly helps this mission grow. And while you are here, tell me your age and where you are watching from. I always love seeing how many people are joining from all over the world. Now, let's talk about the exercise itself, because I do not want to keep you guessing. It is a gentle quadriceps isometric hold. That sounds technical, so let me make it simple. Your quadriceps are the big muscles on the front of your thigh. Isometric means you tighten the muscle without moving the joint very much. In plain English, you are waking up the front of the thigh without asking the knee to bend and grind through a big range of motion. Why does that matter so much? Because your quadriceps act like a support team for the knee. Think of your knee like a door hinge. If the screws around the hinge get loose, the door starts to wobble, squeak, and strain. Strengthening the muscle around the knee is like tightening those screws. It does not make the hinge brand new. It makes the hinge more stable. That is a big difference. This is about support, not magic. Relief, not fantasy. Stabilization, not turning a 75-year-old knee into a 25-year-old knee. In one small randomized trial of older adults with knee osteoarthritis, average age in the low 70s, a home-based quadriceps isometric program improved pain and daily function after 4 weeks. That matters. Not because it was a miracle, not because it regrew cartilage, but because it showed that a very simple muscle activation routine done at home could help real older adults feel and function better. And that is what most people want. Not perfection, just less pain getting out of a chair, less fear on the stairs, less dread when walking to the bathroom at night. So what does this exercise look like in real life? You sit or lie with the legs supported. You place a rolled towel under the knee if that feels better. Then you gently tighten the front of the thigh, pressing the knee downward and trying to straighten the leg without forcing it. Hold briefly. Breathe. Then relax. That is it. No jumping, no kneeling, no deep squats, no gym machine, no fancy gear. Just a controlled squeeze that tells the sleepy muscle, wake up, I need you again. And this is where most people get knee pain completely backward. They think, if it hurts, I should stop using it. Now, sometimes that is true for an injury, a fracture, an infection, or sudden swelling after a fall. But with long-standing knee osteoarthritis, too much rest can become gasoline on the fire. The muscle gets weaker, the joint gets less supported, the brain becomes more protective. Then even normal movement starts to feel louder, sharper, more threatening. It is a little like parking a car for months and expecting it to run better. Usually the opposite happens. The battery weakens, the tires flatten, the parts stiffen. Your knee is not a car, of course, but the principle is similar. Gentle, regular use is often kinder than total avoidance. Not reckless use, not pain chasing, gentle, regular use. That is why this one exercise can be so helpful for older adults. It lets you work the muscle with very little joint motion. That is important if bending the knee deeply hurts, or if stairs feel miserable, or if getting down on the floor is not realistic for you anymore. This move meets you where you are. Now here is the first big mistake people make with it. They squeeze too hard too soon. They treat a tender knee like it is in a boot camp. That backfires. The fix is to think of the muscle like a dimmer switch, not an on-off switch. You do not need a violent squeeze. You need a smooth, confident tightening that feels like work but not panic. If your face is scrunched up and your breath is trapped, you are probably doing too much. The second big mistake is holding the breath. That may sound small, but it matters. When you hold your breath, your whole body tenses, your shoulders tighten, your neck hardens. Sometimes your blood pressure even jumps. Instead, breathe out gently as you tighten the thigh. Let the rest of your body stay soft. Your jaw soft, your shoulders soft, your hands soft. Only the front of the thigh is doing the job. The third mistake is expecting the knee itself to do all the work. That sounds strange, I know, but pain makes people stare right at the sore spot and forget the helper muscle above it. The truth is, a lot of knee pain improves when the muscles around the joint start doing their share again. It is like carrying a grocery bag with one finger instead of your whole hand. Of course it hurts more. The load is not spread out. Here is a debate for the comments, because I know this one splits people right down the middle. Do you think older adults with knee pain are told to rest too much or not enough? I have a feeling half of you will say rest is necessary, and the other half will say rest made you worse. Tell me what happened in your case. Now, if you are wondering why the front of the thigh matters so much, here is the body mechanism in plain language. Every time you stand up, walk, or go down a step, your knee needs a braking system. Your quadriceps are a big part of that braking system. They help control the joint, they help absorb force, they help keep movement smoother. When they are weak or poorly activated, the knee can feel as if every landing is harder, wobblier, more irritating. Think of it like the shock absorbers on a car. If the shock absorbers are worn out, every bump feels sharper. The road did not change, the cushion changed. Your quadriceps are not the only cushion your knee needs, but they are one of the most important ones you can influence without surgery. And here is something else many people miss. Pain is not only about damage, pain is also about sensitivity. When a joint has been sore for months or years, the nervous system can become jumpy, like a smoke alarm that goes off when toast burns instead of when the whole kitchen is on fire. Gentle muscle work can help calm that system down over time by proving to the body that movement is still possible and safe. That is why this exercise is so different from forcing yourself through painful chair squats or going up and down stairs for practice when your knee is flaring badly. It gives your body a lower threat way to start, a safer conversation, not a shouting match. So how do you turn this into a 5-minute habit? Keep it embarrassingly simple. Pick a time you already sit down every day, maybe after breakfast, maybe after brushing your teeth, maybe during the evening news. Put a small rolled towel under the sore knee if needed. Tighten the front of the thigh, hold for a few comfortable seconds, relax. Repeat gently for a few minutes, stopping if the pain becomes sharp, unstable, or clearly worse. 5 quiet minutes. That is often more realistic than promising yourself a 30-minute routine you will never do. The beauty of this is not just the exercise, it is the consistency. The knee responds to what you repeat. A single heroic session does not change much. A simple daily signal does. Your muscle learns, your brain learns, your confidence learns. And confidence matters more than people realize. Some older adults do not just have knee pain, they have fear of knee pain, fear of the next stab on the stairs, fear of falling when they stand, fear that one wrong move means surgery. That fear changes how you walk. It shortens your step. It stiffens your body. It can even make pain feel worse. So when you do a safe exercise and realize, I can use this leg without disaster, that is not a small thing. That is recovery beginning on two levels, body and mind. Now, let's be honest about the title. Big percentages make exciting headlines. But the real reason this exercise matters is not the headline number. It is that short, low-impact quadriceps work is believable, repeatable, and supported by the broader science on knee osteoarthritis. Harvard recently highlighted a large analysis of more than 200 trials showing that exercise helps reduce pain and improve function in knee osteoarthritis. Lower-impact aerobic movement did especially well overall, and strengthening helped function too. So this one exercise is not the whole story. It is the front door into the story. In other words, this thigh tightening move is your starter key. It turns the engine on. But the whole car still benefits from regular movement. That can mean short walks, gentle cycling, water exercise, or Tai Chi if your doctor says it is appropriate for you. Even the CDC says 5 or 10 minutes at a time can count. That is wonderful news for older adults who hear exercise goals and immediately feel discouraged. Most people think improvement only counts if they can walk for half an hour. That is the mistake. The fix is movement snacks, tiny bites, a few minutes of muscle work, a brief walk down the hall, standing up and sitting down with control, a lap around the kitchen while the kettle boils. These small pieces add up, especially when you are rebuilding confidence after months or years of pain. Let me give you a real-life scene that may sound familiar. It is 7 a.m. You wake up, swing your legs over the bed, stand, and the knee complains right away. Not a scream, a warning. You shuffle to the bathroom, you grip the sink. Going down the stairs later feels worse than going up. By lunch, the knee is tired again. That pattern often tells us the joint is stiff, the muscle support is underpowered, and the nervous system is on alert. This is exactly the kind of day where a simple, low-motion quadriceps exercise fits beautifully. Not after you are exhausted, before the day runs away from you. Here is another common mistake. People stretch the knee and never strengthen it. Stretching can help stiffness. It absolutely has a place. But if all you do is pull and stretch a joint without rebuilding the support around it, it is like loosening the ropes on a tent without fixing the poles. The structure still struggles. That is why so many knee programs include both movement and strengthening. And please do not confuse gentle strengthening with punishing strengthening. You do not need deep lunges. You do not need heavy ankle weights on day one. You do not need to prove anything. You are not training for a race. You are training for life, for getting up from the toilet without dread, for walking to the mailbox without bargaining with your knee, for turning in the kitchen without that sudden stab. Some of you will completely disagree with the next point, and that is okay. Sometimes the goal is not to eliminate every bit of pain before you move. Sometimes the goal is to move in a way that gradually teaches the body the movement is tolerable. Not severe pain, not dangerous pain, but manageable discomfort that settles rather than explodes. If you have lived with joint pain for years, you know there is a difference. Tell me in the comments, do you think people are too afraid of any pain at all? Or do you think too many people push through the wrong pain? I really want to hear both sides. Now let me tell you about Margaret. Margaret is 76. She lives alone. Her biggest fear is not the pain itself, it is losing independence. She began avoiding stairs one step at a time, then stopped walking to the corner store, then started using both arms to push herself out of every chair. She kept saying, "I don't want to end up needing surgery just because I moved the wrong way." That fear made sense, but it also made her smaller. So Margaret started with one thing. Not a full workout, not a gym membership, just a daily front thigh tightening exercise with a towel under the knee while seated safely at home. At first, it felt almost too easy. She wondered if it could possibly matter. But after a couple of weeks, she noticed something subtle. Standing up felt less shaky. Going to the kitchen at night felt less dramatic. Then she started moving more in general. That is the honest, hopeful outcome we want. Improvement that opens the door to more improvement. That is the part people overlook. The first win is often not, "My knee is healed." The first win is, "I trust this leg a little more." Then you walk a little more. Then you sit less. Then the muscle support improves further. It becomes an upward spiral instead of a downward spiral. Now, if you try this and think, how long before I know if it is helping? Be patient, but do not be vague. Watch for small markers. Is standing from a chair smoother? Do the first morning steps feel less stiff? Are stairs a little less scary? Can you walk a bit farther before the knee starts shouting? Those are meaningful signs. Pain scores matter, yes, but so does daily life. And please remember, stronger does not always mean bigger. Sometimes the muscle is there, but it has forgotten how to switch on at the right time. That is what this exercise can help restore. Think of it like turning the lights back on in a room you stopped using. The furniture was always there, you just could not see or use it properly. This is also why the exercise works so well for older adults who feel deconditioned. Deconditioned simply means the body has lost some of its training and tolerance from doing less. That is not a personal failure, that is biology. Bodies adapt to what we do often. If you sit more, the body gets better at sitting. If you use the front thigh muscle daily, the body gets better at recruiting it. And there is one more reason I like this move for seniors. It is easy to pair with safety. You can do it seated, you can do it near support, you can do it without getting down on the floor. That matters when balance is not what it used to be. The CDC also reminds older adults to include balance work each week, because the goal is not just less pain, the goal is safer movement. Now, a quick but very important reality check. This exercise is for the common pattern of long-term knee pain, stiffness, and weakness, often seen with knee osteoarthritis. It is not a substitute for medical care if your knee is hot, very swollen, suddenly locked, red, unstable after a fall, or if you have calf swelling, fever, or severe pain that is rapidly worsening. Those are different stories. Different stories need proper evaluation. Also, if you have been told you have severe arthritis, do not assume that means exercise is pointless. In fact, many people with more advanced arthritis still benefit from the right kind of strengthening and movement plan. Again, not as a cure, but as support, as pain management, as a way to function better while you and your doctor decide the next best step. And if you take only one lesson from this video, let it be this. Your painful knee does not always need more protection by doing less. Often, it needs better support by doing the right thing, gently and consistently. That one shift can change everything. So let's bring it all together. The exercise is a simple quadriceps isometric hold, tightening the front of the thigh with little knee movement. The reason it helps is that the thigh muscle acts like a support cable and shock absorber for the knee. The mistake most people make is resting too much, squeezing too hard, or skipping strength and relying only on stretching. The fix is a calm, brief, repeatable daily habit that wakes the muscle up without punishing the joint. The realistic outcome is less pain, better function, and more confidence over time. Not a miracle cure, but a meaningful improvement that helps you live better. And if you remember nothing else, remember this image. Your knee is the hinge. Your quadriceps are the hand steadying the door. When the hand goes missing, the hinge feels every wobble. When the hand comes back, the whole system gets calmer. Before you make major changes, talk to your doctor, especially if you take medication or have a diagnosed condition. Natural does not always mean risk-free, and even exercise needs to match your body and your medical history. This is for educational purposes only. If this kind of calm, practical health guidance helps you feel less alone and more in control, subscribe now, because every new subscriber helps this channel reach more older adults who truly need it. And before you go, tell me this in the comments. What hurts your knee the most right now? Stairs, standing up, walking, or sitting too long? Your answers help all of us learn from each other. And stay with me for the next video because I am going to show you the morning habit that silently makes knee pain worse after 70, even if you think you are being careful. You may be doing it tomorrow without realizing it.